what we did, we start a longitudinal study during the lockdown period among the patients who went to the daycare units for a medical treatment. And in parallel, we conduct the study among the caregivers who work in this department. And our first objective was to evaluate how we modify our treatment among these patients who are ongoing or who has already started their medical oncological treatment. And we modify the treatment in 27% of the case. And most of the case, we modify the treatment in doing some teleconsultation for the patient who have oral therapy. However, we also modify the treatment to postpone some of them. For example, we delay some interval of immunotherapy. Instead of 2 weeks, we move to 4 weeks, for example, and sometimes we cancel some weekly schedule of chemotherapy. However, we only stop the treatment for less than 10% of the patients, and we didn't not so much modify adjuvant chemotherapy. And then we focus on our study on how was the impact, the psychosocial impact on this period of lockdown among the patient and among the caregivers. And among the more than 800 patients already included in the study and for whom we have the results, we found a high level of stress induced by the circumstance. Half of the patient expressed some stress, and 1/4 of the patient have some difficulties with sleep. And it was higher for the patient who had a modification of their treatment. And if we have a look on how the caregiver felt during this period of lockdown, they express a high level of stress as well, higher than the patient, in fact. However, when we ask them how they felt in their work, they have a high level of involvement and satisfaction in their work, even if the situation was difficult. So this is the first step of our study during the lockdown, and now we are going to follow the patient during the next few months, because the problem in the next few months, and we have to adapt and maybe to propose some psychological support to the patient, but as well for the caregiver, in order to not have some post-traumatic stress, because we are on the second wave and the problem will be continued during the next month.